motion and second. All in favor say aye.
Aye.
Opposed, nay. Agenda approved. Next on our agenda, we have the public comment. Is there anyone that would like to address the board? Seeing no individuals that would like to address the board, we'll move on to committee items. We have the meeting minutes of September 8th. Looking for...
So moved.
Thank you. And we have a motion and support. All in favor say aye.
Aye.
Opposed, nay. Motion passed. Next, we have Lifeways. Thank you, Mary Beth.
Yeah. Good afternoon, Commissioners. In your packet, you'll see this month's report. First thing I'd like to start off with, though, that's not included in your report is I'd like to express appreciation on behalf of the board in regards to the support of the county related to the passing of the bond. Well, it'll go this month, but there won't be any issue there. So I do appreciate that. Allows Lifeways to be able to address some of our capital improvement needs. So thank you. The other thing that I wanted to bring up was related to the general fund deficit planning. As you know, we are constantly addressing the ongoing cuts related to our general fund. And I just wanted to appraise you of a meeting that I had actually this morning with Captain Vogt, if I pronounced that correctly, in regards to jail services here locally. One of the things that we changed beginning October 1st was before we used to contract with another provider to provide jail services, mental health jail services. And when we looked at the need for us to be able to reduce our general fund expenses, we did have to look at all of the services that we provide, and jail services being one of them. We decided beginning October 1st that Lifeways would directly manage that. We're not authorizing that service directly. The provider had that, and we want to be able to contain the costs. And the fact that the services that were being provided had kind of evolved over time, and initially it was designed for crisis response. So when they had somebody in the jail who was considered under crisis related to mental health, they would contact Lifeways, and we would send somebody out to address the crisis. It's kind of evolved into a situation where if anybody comes in and they identify a mental health need, whether it was 10 years ago that they received treatment, they were having clinicians go out and assess them. Well, there's a cost to that, and there wasn't any ongoing need identified or treatment. So one of the things that we're doing, and we're doing it in partnership with them because we understand they are also in a challenge right now related to their medical doctor and trying to replace that current provider. So we will continue to meet with them on a regular basis to try to design this so that it's back to the way that it's intended, and which is related to crisis only. But that will take some time. But I just wanted you to know that we are kind of working with the county on that. And we will have a follow-up meeting after they have announced that RFP and who that person will be in order to smooth out that process for mental health services. The other thing when we look at general fund that we've also tried to do is related to looking at our expenses, and one of those expenses we terminated was our contract with DHS for the MARA worker, because that does have a savings of about $54,000 annually on our GF. We continue to look at other ways in which we can manage those costs, but understand that we probably will be in a situation that several other CMHs in our region find themselves in this next fiscal year, is that we will not have enough general fund dollars to cover our need. There's a couple of CMHs within our region that are actually going to be in a significant deficit related to GF for this fiscal year. The local match situation. As you all are aware, that's been kind of a fight that I've had with the department about whether or not they can take our general fund dollars related to making that match obligation. We follow the process in our contract related to dispute resolution. I was really hoping, and I think I discussed that at last month, that they would come up with some type of settlement with Lifeways related to withholding our general fund appropriations to make that match. And they have agreed to continue to uphold their belief in the fact that they believe that the contract supersedes statute. We're at the point now as a board where we need to, and we'll be discussing this at our Finance Committee meeting, about next steps, because you do really have to weigh what our options are. To pursue it legally, one, there will be a cost, and that cost cannot come out of, it have to come out of local, could not come out of Medicaid or general fund. The other issue is that the state, if you were to look at it from the perspective of if we were to win on those grounds, it would be implications statewide related to the local match issue. That would have a reduction in the CMH system for Medicaid funding because those dollars pull down additional Medicaid. Now for Lifeways, our Medicaid is fine. We have enough Medicaid dollars to meet our obligation. That's not the case across the state. And it would have an implication for Lifeways of a reduction of about $3 to $4 million. So it's a challenge. It's a challenge because then there would be a loss in services locally versus the local match obligation of $426,000. So we're going to have to weigh that as a board and make a decision about next steps. But I did want you to know that what our efforts were as an organization in support of the county related to trying to fight the local match issue and trying to get the state to change policy, because that's really where it comes down to. The state has to change current appropriation language that no longer requires that obligation of the CMHs, which ultimately is the county, because the only place a CMH can go to get that additional funding if it's needed is the counties. So I wanted you to be aware of where we were related to the local match. The other thing in your packet is you'll see that there's the attachment for fiscal year 16 budget. Our board did approve our budget at last month's board meeting. The challenge is that currently we do not know what the rates are for Medicaid for fiscal year 16. The states are still currently negotiating what those rates will be across the state. So we did draft our budget based on some preliminary predictions based on current funding, but understanding that there is a potential that there will be a reduction in Medicaid across the state, which would require us going back together as a board and making revisions to that budget, so making reductions. As a leadership organization, within our organization, the leadership team has been meeting to talk about projecting for a 1.5% potential reduction and planning for that, and where would we make those reductions. And primarily, we would do it on the administrative side and not on the service side. We would want to be looking at those service costs that are high, like our inpatient, but other than that, primarily we would be looking at our administrative line related to that 1.5% reduction. I also wanted you to be aware of the fact that as Mid-State Health Network, which is our regional PIHP, they did select a new CEO, and that is one of our board members, Ed Wood. So if you know him and you can congratulate him on that, that's a good representation for us as Lifeways in this region. They did select the new CEO for Mid-State. Do you have questions? You need me to stop? Oh, okay. Oh, I'm sorry. Mid-State did select its new CEO. As you know, Nancy Miller is resigning. And Joe Sedlock, who is another CMH director, long-term within the system, also has extensive SUD, substance use disorder background as a coordinating agency director. So it's a good fit. Both candidates that they had would have been very good candidates for a region. So they do have that selection. The other thing that is in this package just kind of talks about the challenges related to the Medicaid rate and where we are as a region, because the state has still not decided what that formulary is going to be. There was a lot of discussion about, and I think I shared this at the last report to the commission, was they are trying to look at equity and basing it no longer on historical use. So if you were a well-funded CMH, you will still continue to be well-funded, but really trying to look at what are the needs in each of the counties. But I'll keep you appraised because I anticipate that we will have to do a budget amendment. There are a couple of things that are occurring at the state level. One of them is related to the Certified Community Behavioral Health Clinic. We just came back from a few of us, board members and myself, who were at Capitol Hill. There's a Hill Day in which CMH directors and board members from all over, not just Michigan, meet with legislators and advocate on behalf of policy issues that are critical to our field. One of those is related to the CCBHC implementation, and as you know, that's related to the Mental Health and Excellence Act that Senator Stabenow passed. There's a lot of hope that Michigan, there's only going to be 28 states for pilots. We do believe that Michigan will be one of those pilots. And that does have implications because what that would allow is federal funding to come down to the level of a community mental health, similar to the funding that a federally qualified health center gets. And those are things that would have significant savings, especially around things like pharmacy, because we don't get 340B pricing, significant savings. So as an organization, we are strategically trying to look at and align ourselves for those standards. So, and the last thing is just related to the Medicaid waiver. And if you many are aware that the Healthy Michigan is up for a waiver approval, and if they do not get the waiver approval, Healthy Michigan will actually no longer be in existence in April of next year, which would have a significant impact on Lifeways, because when they implemented Healthy Michigan, they reduced across the state $200 and some million out of the general fund bucket because they shifted these people over to Healthy Michigan. If they remove Healthy Michigan, it's not likely in the current funding state the state is in that they're going to put those general fund dollars back to the CMH. So you're going to have people who once had a service mental health benefit and a need who no longer have that, and we're not going to have the general fund dollars to serve them. So we're hopeful that Michigan will get the waiver approved, which we'll know the end of December. And that is it for my report.
Commissioner Shotwell?
At the beginning of your report, you discussed the possibility of a deficit. Who will be responsible for making up that deficit if you go into one?
Well, no, not the we would be in a situation similar to what some of the other CMHs are finding themselves in, and that is you'll be in a structural deficit, similar to when we had the local match problem and we were in the structural deficit. This would start a structural deficit related to general fund, unlike local. We might be able to, based on our current local, because we're not making that match payment. Some of our local dollars we would be able to divert to provide some of those general fund services, but that's why we are trying to be proactive and really look at where can we make reductions in planning for that potential deficit.
You mentioned Healthy Michigan and the possibility of it going away, and the dollars then going away. Mm-hmm. The state is in a tough financial situation right now on mental health issues?
General fund in general, we're already advocating from a general fund perspective that the state put back some of those general fund dollars, that there are people that we serve who will never be eligible for Healthy Michigan and are not eligible for Medicaid, yet they need mental health services. There's many people that we provide services for. A big one is the population called a spend down or a deductible, if you're familiar with that. Some of them have spend downs and deductibles, in the thousands per month. When an individual is eligible for mental health and they have that spend down, those services that are provided until they meet that spend down comes out of general fund. We spend probably $270,000 annually on that population alone. And so we've been advocating that they put general fund dollars back in, and what we're hearing from our association is that the current state related to the state's budget is not likely that they'll even put that back. So the thought that they would put 200 million back is probably not realistic.
How big is that population in Jackson?
I could get you the numbers. Last I knew it was around 150 people.
Okay.
Commissioners, what other comments or questions might you have for Mary Beth? All right. Thank you for
All
that
right, thank
information.
you.
Thank you. Next on the agenda, we have Region 2 Area Agency on Aging. Ms. Weatherby, welcome.
Good afternoon. You should have a copy of the report that we sent out a couple weeks ago. I'll just highlight a few of the things. There's totals for funding through October 1st through June 30th of 2015, and there's a timing issue why it's not more current, but we have totals by the different funding sources that we provide to Jackson County. Total funding in Jackson County is about $8,059,582. We serve about 407 waiver clients and 53 care management clients. From October 1st through September of 2015, we had approximately 1,219 calls for information and referral for Jackson County residents, and we do refer those calls if we can't provide services or have services at the Area Agency on Aging. We do refer many of those calls to the Department on Aging. Other things that are happening at the agency, we are kind of in, we have worked on our fiscal year 2016 budget. We haven't gotten our capitation rates from the state yet. There is a meeting in a couple weeks, so depending on how they change our capitation rates, that will affect our budget too, and that's for our Medicaid waiver population. We do have a contract with our total funding, but it's kind of one of those things where they give you the total funding, but they haven't separated it out into capitation rates by population. So until we have that, it's hard to forecast on our budget because we have people spread out in those different capitation categories. A quick update on the Tomei Pace facility. It's out on Springport Road. Region 2 is a partner in the facility. I went to a board meeting last week and had a tour of the facility. It is beautiful. They're in process of going through their state authorizations, and they had a readiness review a couple weeks ago, and they had a couple things they had to fix on the readiness review, so those state officials are coming back in this week. And after the readiness review is approved by the state of Michigan, then there's a 90-day waiting period before they can start accepting participants. So they anticipate accepting participants in February, depending on the holidays and things like that, but they're thinking the first ones will be in February. And there will be an open house scheduled. It had been scheduled previously, but it had to be rescheduled because they're not allowed to do any sort of marketing or things like that until their readiness review is passed. So that's an exciting event that's going to be happening. And just for those of you that don't remember what the PACE Center is, it's an option for folks to go there for the day, their doctor's appointments, their pharmacies, any kind of meals, all those types of things will happen at the center, or the participants will be driven to specialist appointments. Transportation is included in the PACE Center, so there's actually a bus service that will go out and pick the folks up and bring them into the center for the day. It doesn't have to be every day, but it's usually at least one day per week that they would come to the center. So that is a big boost for participants in our county. And also it will serve Lenawee and Hillsdale County as well. The other thing that's been happening at Region 2 is We had purchased a building next door to us, so we're in the process of remodeling that. We had ran out of space with our existing facilities. We weren't ADA compliant on the number of restrooms and things like that, so that is in process, and we're hoping by the holidays the remodeling will be finished. We did, as members of the Region 2 staff and our board members, we had strategic planning happening in the last couple months. So I will make sure to get a list of our strategic plans sent out to the commissioners. But it's an exciting time to kind of, as a group, we all came together and brainstormed and came up with our strategic plan, and we're planning to, as we do our monthly reports, I'll keep everyone updated on where we are in our plan. I think that's about all I had, unless there's any questions.
I'd like to start with one. On the
Okay.
document in front of us, in the bottom line, it says transportation under the services provided. And it shows us in that time frame, 147 clients were served. My question for you would be, what is the criteria needed for someone within the community to receive that transportation service?
I would have to check for sure on the criteria. I know through the Medicaid waiver program, we're not allowed to transport folks to doctor's appointments and things, but I think this is more volunteer transportations through the Department on Aging that this funding is for.
Okay, so you don't think it would be for dialysis, would not be?
I don't think so.
That would be my question.
Okay.
Just constituents that have issues right now with transportation and dialysis.
Okay. I know for us, we have to rely on DHS to provide transportation to doctor's appointments through the Medicaid waiver program. We're not allowed to do that. So we have to, the clients have to seek that through DHS, and then if they get a denial from there, then we can provide some transportation through the Medicaid waiver program. But I know this transportation right here is different, so I will check on that.
I would appreciate any insight to
Okay.
give to that constituent. Thank you. Commissioners, what other comments or questions might you have? All right, thank you for that information.
Yep.
Next on the agenda, Department on Aging. Ms. Wendell?
Good afternoon. Just to clarify too, there's transportation services at Lenawee County Department on Aging, but not Jackson County. It's through Catholic Charities. They have volunteers that do transportation. So I think Julie was talking about maybe Medicaid waiver related transportation, but the grant funded is at Catholic Charities. Senior nutrition site on the south side of the city of Jackson, we've been working to relocate that site to a place that has a little bit better parking, and the location at the King's Center on Adrian Street has been approved, and the site has moved, and they've been operating there for a couple weeks, and things are going quite well. So we're real pleased that now we have a site at the Martin Luther King Jr. Center. In my written report, I just commented that the Senior Reach grant potential that last month I verbally reported that is not moving forward, but because I had it in my written report last month, I wanted to have it in writing this month that it's not moving forward. Our annual volunteer recognition is this Friday, and it's a time for us to say thank you to all the volunteers that help us out in our providing services. And also, we take it as a time to honor another service provider in the community. And this year, that service provider is Disability Connections. We work with them in caregiver respite for caregivers, and also we have a caregiver supplemental grant through the Area Agency on Aging that has helped pay for wheelchair ramps. So the grant has been able to pay for supplies, and Disability Connection has coordinated the building and the labor to build those ramps. Grass Lake Senior Center, Food with Friends. A few years ago, we had a Food with Friends at one of the churches in Grass Lake, and what that is it's not our regular senior site meals where we bring a lot, what we call food in bulk, and then it's served there at the senior site. These are
packaged meals, like a Meals on Wheels meal, and they were cold meals dropped off at the group of senior citizens who are getting together, and then they distribute the food and the meals. And then that kind of, the pastor at that particular church retired, so that stopped. And then, but now the Chelsea Senior Center has asked us to have a Food with Friends site at the Grass Lake Township Building, and that's what's happening on Tuesdays and Thursdays. So their hot meals are, again, are individually packaged so that we stay within the food service guidelines. People aren't serving the food. It's individually packaged like a Meals on Wheels. So the driver takes the meals for Grass Lake to the Napoleon Township Building, and then a volunteer comes to Grass Lake and picks up those meals and takes them to Grass Lake. And then the next day, when the driver's out in the Grass Lake area, they pick up the hot boxes that hold the meals, get any donations, signature sheets, client information, that type of thing. So we've worked that out with Chelsea Senior Center, who now has a senior center in Grass Lake at the township. And our second Classic Car Festival, our community outreach event, was September 21st at the Jackson County Fairgrounds. We're estimating about 600 people of all ages, so the weather was beautiful, which really makes a big difference. But again, it's to get the word out to the community about the Jackson County Department on Aging, what resources there are, and encouraging people to contact us whenever they have a question about what services are available. And Crouch Senior Center, we have two senior centers. One's at Spring Arbor. It's a township building that's a senior center, and then Crouch Senior Center. And I just kind of want to walk you through visually. Crouch Senior Center is the former medical care facility. So the wing that goes north-south, the kitchen's at the very south, then there's the dining room, then a multi-purpose room. And across from the dining room, there's another large room. And then there's, in the east-west wing, also there's other classrooms, computer lab, that are used for senior center programs, enrichment activities. The multi-purpose room is just that. It's used for a variety of reasons. Exercise classes, quilting, woodworking, painting, euchre, bridge. We have evening classes sometimes, so we hold the classes there. And there's been a pool table there for quite a few years, and a couple years ago, pool playing has become quite popular, and the primary pool players asked for a second table. So there isn't, to keep it a multi-purpose room, there isn't space in the multi-purpose room for two pool tables. It's not like you can fold them up and put them against the wall. So the cooks in the kitchen said we can do things differently. The way we prepare the 500 meals to get them ready for the 14 meal drivers to pick them up, that's all staged in the room across the hall. And the cooks said we could do this a little differently so that half of that space could be used for pool tables. So that's what's happened. Friends of Jackson Seniors purchased a portable room divider. It has divided up that room between the tiled area and the carpeted area. So now there are two pool tables in the carpeted area. And I checked with facilities before we moved forward with this to make sure it was okay with them to do this. So it's, you could say it's cramped when they have a pool tournament, but it's a much better option than at the multipurpose room with one table. So just wanted you to know that we do try to accommodate preferences, but we have to accommodate many preferences. So that's what we've been working on, especially Brietta Allen, our enrichment specialist, and Lori Carpenter, our nutrition services manager. So.
Just out of curiosity, have the guests challenged you to a game, Marcy?
No, they have not.
No. Would you decline if they did?
Probably.
Probably, because I think maybe there's a commissioner over here to my left that I would submit his name to, give it a try.
Yes, they have a tournament on Thursday mornings.
All right. What time? See, there
It's
we
in
go.
the newsletter. I want to say 11 o'clock.
Thank you for that information. Commissioners, does anyone have a question or comment for Marcy regarding her report?
Okay,
Thank you for that
all
information.
right, thank you.
Next on the agenda, we have Animal Shelter Quarterly Report.
Good afternoon, everybody. Hoping everything's been going well. Just going to briefly kind of go through the staff report and outline some key points. We want to thank Friends of the Animals of the Jackson Area Incorporated again with Pets for Vets, another successful campaign back in July. Now, there is some question whether that will be able to continue because the original donation that had come into Friends to fund this for the past 2.5, 3 years has been utilized. They're actively trying to replenish that fund. So I'm not exactly sure whether the traditional November Veterans Day campaign will happen this year. Stay tuned for details
Was
on
that an anonymous donor that,
Yes, I know who it is. It is associated with a member of the board of a key person's deceased husband, but they prefer to keep it that way. So they're looking to try to replenish that fund in other avenues. As you all know, as I mentioned previously, our veterinarian broke her arm, shoulder area earlier in the late spring, early summer in a bike accident. We were able to keep pace with the surgeries by utilizing Cascades Humane Society as a safety valve. We also brought in Dr. Aaron Whalen from Livingston County and Lenawee County Animal Shelters on a part-time basis, as well as Friends of the Animals was able to do a little bit with organizing some of the community cat project surgeries. So we were able to keep pace. Dr. Anderson is nearly 100%. There's still a little bit of weakness when she's been doing surgeries for 3, 4, 5 hours, but she's getting back to normal. We did have a August 1st adoption event out at the animal shelter on Saturday, August 1st. It went quite well. We had a lot of volunteers come out. We had a couple sponsorships, Unleashed and Loving It. I believe Pet Supplies Plus as well has now stepped up and provided the check that they had originally promised. And so we actually did increase our adoptions, what would have been normal 1, 2, 3 dogs and cats. We actually did 6 dogs and 6 cats that particular day. Due to the success of it, we are also planning a Halloween event. Coincidentally, Halloween, the 31st, actually is a Saturday this year, so during normal business hours, we're doing another adoption event, bigger and better than the August 1st one, so that'll be in the fourth quarter report. We have a security system that was donated by Friends, and I've got 3 of the 4 cameras installed, working with facilities to get some power outlets to do a few more cameras in key locations, but it has already proved its worth. We've been able to avoid a couple dog fights from community service workers, not keeping them separated as they pull forth. Our front desk clerk can kind of monitor the back kennel areas. When you don't have a lot of staff, it's good to be able to see the other areas just to make sure nothing's going amiss, if you will. I also brought in on September 4th a psychologist from Deepwater Consulting who is an expert on compassion fatigue for a staff, not a staff training, but basically a staff session. Animal shelter, municipal work is a stressful environment. We do a lot of euthanizing due to the nature, the fact that it's an open shelter, a municipal shelter. Compassion fatigue in the animal shelter business and industry is a common thread. It is somewhat similar to post-traumatic stress syndrome that we're all very familiar with. So I was able, for a very nominal fee of $150, bring this counselor in for a 2-hour session. It went well with the staff, and I plan on doing this on a yearly basis in the mid to late summer period of time when things are getting crazy. They've been crazy for 2-3 months with cat season and everything, and it went over well with the staff. I don't see a problem with bringing it in again. Helps little group therapy, so to speak. Things helps with the psyche. So I wanted to bring that to your attention. Facilities has been doing their project upgrades. We got some additional insulation. Just last week, they were finishing up the lighting upgrades. And I will tell you, I'm expecting some utility savings because the upstairs office, after they put the new insulation in, went from the high 80s, 90, low 90s, down into the mid to high 70s. I'm a happy camper. And it's been, since the insulation went in, that office up there and the area up there has been much cooler, so the AC can keep up. So I'm expecting some utility savings from that project. The second annual golf outing was a smash hit, bigger and better than ever. We've already seen some dividends from that just this past Saturday. A majority of the dog and cat beds were brought in as a donation from Friends of the Animals of the Jackson area. So it's my understanding that they raised double the amount of money as they did last year. So it appears to be a pretty good fundraiser moving forward. And then you see some numbers there in your report. I will say that intake's down a bit from previous year. Our 9-month year-over-year totals statistically are down as well. There's really only one thing that really concerns me as I bring to your attention, and I don't know the reason for this, but our cat adoptions are down. I don't get too worried about a 2 or 5% decrease one way or the other, but my cat adoptions for the third quarter were down 7% based upon intake, and then my 9-month year-over-year totals, they're down about 13-14%. I'm not exactly sure why that would be, other than perhaps the carrying capacity of Jackson County may have been reached for the number of homeowners looking for cats. Our dog data is remarkably consistent across the board as far as percentages. So I'll entertain any questions that you have.
Thank you. Don, if you would follow up on the cat issue for a second. I'll preface it with this last week on the radio, the local AM talk radio station, a lot of callers were making phone calls in simply talking about stray cats in their area, cats roaming the area. So for the sake of the board and the public who may be listening, what is the plan, what is our policy if, let's say a constituent calls me and says there are stray cats in the area, short of telling them, make sure you're not feeding them, what is the plan or policy?
Well, we do not go out and pick up cats. The local police agencies do not pick up cats. They have to come in. We accept cats on Tuesday and Wednesday and Thursday afternoons on a week-to-week basis until we are full with cats, until we can't take in any more cats, and then we essentially post a sign saying, sorry, we are completely full. By state law, we do not have to accept cats, only dogs. As a matter of policy, we do. We do that Tuesday, Wednesday, Thursday afternoon intake as a matter of policy for a management point of view. Makes it easier. Mondays, we tend to have a lot of things happening, carrying over from the weekend. And then Friday afternoons, getting ready for the weekend, tend to be very busy times. So have we seen, some compression of the cats being brought in on afternoons, Tuesday, Wednesday, Thursday? Yes, but the staff seem to prefer it that way. Now, when it comes to bringing in the cats, I hope I'm answering your question. We will take them in until we have no place to put them.
Okay. So then the answer to a constituent would be you may deliver, if you choose to do something about it, you can deliver it to the shelter.
Yeah, we also have, and this has been ongoing, and Friends of the Animals helps support this, the spay-neuter program, and it's the Community Cat Project. And so those who, may not have the means to spay or neuter their community cat, kind of the one that's hanging around the house, they're feeding it, but it's not an inside cat, if you will. Or if it is an inside cat, they let it out on a nightly basis or a daily basis, and essentially it's their cat, and it gets out and about. We're making every attempt to spay and neuter those type of cats.
All right, thank you for that information. Commissioners, any other comments other than Commissioner Duckham? No, I know you too well. All right, seeing none, thank you for that report, that update.
Thank you very much.
Next on the agenda, we have Health Department, the third amendment to the Health Officer Services Agreement between Allegiance Health and Jackson County.
Good afternoon again, Commissioners. This is the third amendment to the Health Officer Services Agreement. There are no changes to it from either Allegiance's perspective or from mine. I think it's working very well, and Allegiance is interested in renewing the agreement through this amendment.
All right, so we are looking for, Administrator Overton, this does not, we're just going to approve it here as a third reading? Or I'm sorry, this is the third amendment. So we're just going to approve it here? Okay, it simply just does not say that. All right, so I'm looking for a motion to move this to the full board. We have a motion and support. All in favor, say aye. Aye. Opposed, nay? All right, approved. And next on the agenda, we have the contract with Michigan Public Health Institute for participation in field testing, a home visiting quality assurance system tool.
Yeah, we were approached by MPHI with the support of DHHS to participate in a study to field test the system tool that's being placed out in the community, if you will. So they recruited 10 home visiting sites. We elected to offer to participate in this. We do a lot of home visiting, as you're probably aware of, through our maternal and infant health program. And so we felt this would be a good way for us to do some quality assurance work in our program and also support a system tool evaluation effort by MPHI. So they've offered us $10,000 to participate in this study. Not a lot of money, but we're more than happy to accept that and use the funds to help support probably the program and the clients in the program. This particular agreement that I have actually only covers a period of August 1st through September 30th. They needed to do this to meet state contracting requirements, and we'll probably see another one of these come forward sometime this month. But
Right.
that's it in a nutshell.
All right, so at this point, I'm looking for a motion to send this contract agreement to the full board. I have motion and support. All in favor, say aye. Aye. Opposed, nay? Motion passed. Thank you.
Thank
Next
you.
on the agenda, Health Department contract with Jackson County Intermediate School District for early on services.
This is our annual contract that we normally bring to the board every year with the Intermediate School District. I'm pleased that we're able to get it to you in this time frame. In the past, it's usually been like February, March, and the school year is just about over. So I think we've been working diligently with the district's school district staff, and they were able to get this to us in a much more timely fashion. So the bottom line, I guess, in terms of our kind of a cost-shared relationship that continues on with the school district is that the health department fund balance would contribute about $24,000 to this program. That's a little bit of an increase over the previous year, but not much. We have also encountered some changes in staffing related to this program in the health department, so we think we're actually going to have an opportunity to be more efficient and reduce some of our costs, so we probably won't spend the amount that's indicated here in this agreement.
At this point in time, I'm looking for a motion to send this to the full board to approve the contract. We have motion and support. All in favor, say aye. Aye. Opposed, the same. Motion passed.
Thank you.
And now your Health Department monthly report.
It's been a busy month, and wanted to touch on a few things that I have in my report. Strategic plan development is one of the things that we've talked about at the health department for almost the entire time frame that I've been here in Jackson County, from the perspective that we've been doing some self-assessment tools that help prepare us for national accreditation, which is something that we want to achieve down the road, perhaps looking at making an application in that program in 2017. But one of the things that's key and critical is that a health department has to have a strategic plan that's been reviewed and approved and supported by our county board, if you will, in order to make that application and to satisfy the accreditation requirements. So we've identified an opportunity to get some resources to do that with a facilitator, and we've already identified a consultant that would work with us to support this effort. We can receive up to $15,000 to support this through a application to the National Association of City and County Health Officials. So I submitted that application back in September. We should know something this month, but I just wanted to share with you that this is something that if we do get the funding, we'll be moving forward beginning in the month of November. We do the climate survey every couple of years, and we just wanted to share with the board that we do take these results seriously and we process them internally. And our leadership team in the health department will be reviewing the survey results and the areas of success and other areas that we need to continue to work on in our meeting this month. Continue to work on a number of things, health integration related with Allegiance Health. An Access to Care Coalition is getting formed up to deal with some of the issues I've previously described to the board about how we coordinate in the delivery of healthcare services. When we make decisions to stop doing something, we didn't really have a forum to sit down as a group and have a conversation about, well, if we're going to stop doing this, what's the backup plan? How are we planning to basically meet the needs in the community if we need to make some sort of a system change? So that's been moving forward slowly. Pleased to report that the community is interested in asking if the health department will provide some leadership and kind of champion this coalition, and I have indicated we would agree to lead it. It's probably not one that would meet on a routine basis, but more on a need-based basis. And as that gets moving forward, I'll bring more information back to the board so you understand how it kind of works. There is a sustainability financing group that's also been meeting primarily within Allegiance Health proper, but the reality is that we're going to need to have more conversation in the future with employers, and that would certainly include the county as well, about how we're going to make the transition between paying for volume-based services and paying for health outcomes. It's kind of a really large leap to get there, but you got to start somewhere, and I think that this particular group could help us rethink and engage with different people and different employers in the community, start talking through this process. It's pretty complex, but I think there is a way to get there. We had some salmonella cases reported to the health department back in September, and two of them seem to be linked together from a group of people that stayed at the Jackson Fair for the entire week. There were no other connections between these people and the fairground attendees or the people that normally are in RVs and parked on the particular fairgrounds. Both of the confirmed cases were among a total of 7 cases interviewed. There were approximately 6 to 10 people out of that 20 that became ill. We did send an outbreak report to the state, and it resolved itself relatively quickly. So we weren't able to identify any particular source of the infection. Usually it's food related. These people did participate in kind of a family, kind of a potluck meal where they may have prepared food themselves versus it having been purchased from a restaurant or from vendors on the fairgrounds. So that's kind of where we think it originated from, but we probably won't be able to really prove it. We continue to have some focus on 19 to 36-month-old vaccination rates in the community. You may have seen some national press recently here, and press based in Michigan, showing that Michigan had a 5% decrease in the point estimate for vaccination rates in this particular age group, and that's a little concerning to us. I think it continues to underscore why we've had more discussions and conversations here with you about forming an immunization action coalition in the county, and the first organizational meeting of that coalition will be in October. So we're excited to get that launched so that we can maintain the kind of focus on not only this age group, but other age group vaccination rates in the community. We've had some staffing changes take place in our they've actually been implemented in the communicable disease and maternal infant health program. We've been trying to figure out a way of using staffing more effectively, more efficiently, and meeting the longer-term needs of cross-training staff between immunization and STD clinics. So we've made some staffing changes, primarily involving casual type of paid employees, if you will, in the health department. And now we're going to look at bringing those resources together to hire a part-time nursing position that can support both clinics. So I think it's going to be a good outcome for us when we're able to accomplish that. The influenza survey analysis report was an attachment in your packet this month. And if you have any questions about the content of that analysis, please let me know. But the bottom line is, I think we're excited and pleased to be able to come back out into county employment buildings, if you will, to offer the flu vaccine. We used to do that years ago. I'm not exactly sure how we moved away from it, but there will be 4 locations now this year that will be offering flu vaccination, and we're excited to be able to do that. Some other updates, if you will. September was Safe Sleep Awareness Month, and we continue to maintain a focus in the community on safe sleep because we do continue to have some infant deaths that occur every year that are related to safe sleeping, whether it's in the crib with things that shouldn't be in a crib, or it happens to take place when moms sometimes will want to sleep with their babies on couches or in beds, and sometimes what the tragic end is that suffocation can result. So we continue to focus on that. I talked earlier this morning in the Personnel and Finance Committee about the Michigan Abstinence Program funding increase, and I appreciate your support for moving that forward to make some staffing changes in that program. Health education and health promotion. We've continued to work with community partners on the Tobacco 21 resolution. As you might know, that this resolution is all about encouraging our state legislature to consider increasing the legal age to purchase tobacco to 21. There are a lot of potential benefits associated with doing it, and the Intermediate School District Board of Education unanimously passed this resolution. We'll be looking at it in the Health Department staff meeting this month, and also the HAO Coordinating Council will consider it in their November 2015 meeting. So the more we can get support for this, the more likely we are to see some action take place at the state level. Building Healthy Communities grant update is in my report, along with a Safetyville update under Health Education, Health Promotion. Let me know if you have any questions about either one of those. I think everybody probably is at least reasonably familiar with the Michener Plating Facility investigation and cleanup that we've been working on with county law enforcement and emergency management. Mike and Adam have been involved in meetings to a certain extent as well. And we just want to make sure that this facility is well controlled, secured, and cleaned up so that we don't end up with some sort of a major contamination disaster in the community. It is right in the middle of our city. Don has already updated you on animal shelter events, so I don't think I need to cover that, and I think that would be my report for you.
Commissioners, comments or questions for Richard? Commissioner Placzek?
Good afternoon.
Hi.
Any update on West Nile virus?
We did do a press release on West Nile virus in the past month or so. We did, it was kind of interesting, we had some submitted specimens to the State Agricultural Lab that actually does the testing for this, and we didn't get the results until early October, if you will, which was kind of a little bit of a mystery to me, but I think they had a backup. But there were 4 corvids, which are usually crows, which tested positive for West Nile virus here in Jackson County. So what that means to us is a couple things. Number one, we know that West Nile virus is present in mosquitoes in the community and in corvids. And so the standard precautions and message that we give to everybody through press releases and elsewhere is to protect yourself against mosquito bites. That's the way that human beings contract the illness. We don't have any human cases reported in Jackson County, as far as we know.
Commissioners? All right, thank you for that report, Richard.
Thank you.
I would ask the indulgence of the Human Services Committee to add one additional item under committee. At the chair's discretion, I would request that we'd ask Paul Burnham to come up and give a report. Paul? You back there? Paul is with Community Action Agency's CABG update. Director Barry informed me last week that she had some information that she wanted to have shared, and my apologies, it did not make the agenda. So Paul, if you'd like to give us a brief update, that would be great. Thank you.
Thank you for adding me at last minute here.
Welcome.
We've just recently finished up our, the last CDBG Community Development Block Grant homeowner rehabilitation program this July. With the grant, we were able to serve 10 homes within the county that were outside of the city limits. The city actually receives kind of the same funding as a entitlement. So we're not allowed to work with residents inside the city limits, but basically everywhere else in the county we're able to help. Basically out of the 10 homes, 7 were full rehab projects, averaging about $27,900 each. We did 3 homes with emergency repairs, averaging about $1,800 apiece. This cycle, this last grant round, MISTA required that everybody participate in a targeted area placemaking effort where 50% of the grant funds would go be utilized within those targeted areas. Our initial targeted areas, we were unable to find any eligible applicants that were interested in the program. We were able to, at MISTA's approval and county approval, we were able to add 2 other areas, 2 other townships that allowed us to meet our 50% expenditure goals under that. This upcoming CDBG grant cycle, they're not going to require the 50% to be targeted in those targeted areas, just because across the state everybody struggled with that. It is, for the next round of CDBG funding, it's going to be a competitive process, and points will be given for areas that are focused in the targeted, that focus the dollars in the targeted areas. I think at this point, I'm not sure if, with the late addition, if any of my photographs of the projects or any of the information was included in your packets.
Not that I'm aware. Mr. Brownwell, do you?
No, but we'll make sure that gets into the minutes and add it to board docs. So
Right.
I'd also add, we're meeting next week on the 19th, I think it is, with the MISTA representatives to go through an audit of the program, and as we discussed last week, we'll have to do a competitive application for next year's allocation.
So I'm hearing you to say that things could significantly be different.
They could. We're hoping for the same, but
Paul, do you have anything else to add?
I'd be happy to answer any questions you may have.
Mr. Shotwell?
You mentioned 3 emergency projects that you had to be involved in.
Yes.
If we go to the new system of where we're no longer just receiving block grant money, we have to actually compete for it, how will we as a community address those emergency situations?
I know MISTA is still ironing out the details on that. I believe initially they were going to have everybody that was a recipient of those funds be able to identify the projects ahead of time and then request funding for those. I know they've since kind of lessened their restrictions on that, and I think it'll be something that if we can't help with initial funds, we could always use program income or things of that nature to cover those.
So the thought is that you would use program income to repair and then go back and request reimbursement then of an emergency situation?
I think we could use program income to do some emergencies that we may not have time to request from MISTA to use grant funds for.
My concern, having some rural residents, is that if we end up with a situation where a septic system fails, or a heater a furnace goes out, or a water system fails, or something like that, in the middle of a crisis time period of extreme weather, how, if we're not receiving the money, the block grant money, do you believe your office has the funding to be able to work in those emergency situations, or pipes break, or whatever?
Yeah, typically the emergency funding for this grant has typically been limited at $2,500, basically for amount between $1,000 and $2,500. Any additional amounts, sometimes we've used leveraging with DHS or our weatherization program, other sources as we can. In some of those cases, septic goes out, things like that, it wouldn't fall under the $2,500 limit that we have. It'd be more of a full rehab to take care of something that big. But typically with the emergency funds, it's kind of a misnomer because MISTA requires quite a bit of paperwork and application time. So it's not their furnace goes out, we can be there the next day. Unfortunately, it doesn't happen.
Commissioner Mahoney?
Just two quick questions. And I'm sorry, what did you say your name was again?
Paul Burnham.
Okay, so that's 3 questions. That was my first one.
Okay.
Paul. Okay, Paul. First question would be, if someone does have an emergency situation, who would they contact to seek some help? Do they just contact?
Typically, they would contact myself
Okay.
or somebody else in our office.
Okay. And then the second question would be, seeing that you guys don't serve the city, do you know the name of the program through the city that is similar to this program?
Yeah, it's just the city's home rehab program. I believe it's Lori Huff with the Community Development Department administers that program.
Okay, thank you.
Welcome.
Thank you. Seeing no other comments or questions, thank you, Paul, for reporting to us.
Thank you.
Next on the agenda, we have the September claims. We have a motion and support to pay the claims. All in favor say aye. Aye. Opposed say nay. Claims are now paid. Other meeting minutes. We have 2 meeting minutes from the DHS board for your review. In addition to that, we have our November reporting schedule, Department on Aging, Health Department, Lifeways, and Medical Examiner. That leads us now to public comment. For our second public comment, is there anyone that would like to address the board? Seeing none, that leads us to committee member comments or commissioner comments. Seeing none, I adjourn to the call of the chair.